Hello, everyone. We're back with another interview for the UCLA COVID-19 Vaccine Confidence Project. My name is Leila Khorasani, and today I'm going to be interviewing Dr. Jodi Coates. Dr. Jodi Coates is a critical care surgeon based in Sacramento, California. She completed her residency in surgery at UC Davis Medical Center, and she currently practices at Mercy San Juan Hospital. And in addition to her work as a surgeon and as a healthcare provider, she's also a parent to a child with special needs. And so just to kind of recapitulate everything, the goal of our project is to help promote vaccine confidence within the disability community. And for Dr. Coates, we're really interested in your perspective, not only as a direct service provider, but also as a caregiver to a child with special needs. And we're really excited to learn from you. So with that being said, we'll go ahead and jump into our questions. So the first thing we wanted to ask you was kind of what are some ways in which healthcare providers and service providers have facilitated the vaccination process? And this can either be the COVID-19 vaccine or just kind of vaccines in general throughout your experience.
Yeah. Well, thank you very much for having me. I'm very happy to be here. I do have sort of the unique perspective of seeing things kind of from through both lenses. So I can speak a little bit to both sides of things from my perspective. From the perspective of a healthcare provider, I would say from the side of healthcare providers, I feel like there has been a lot of effort in terms of vaccine availability, particularly as it relates to COVID-19 most recently. But I sometimes feel like that sentiment isn't so much echoed on a community side. And I will say that I feel like I know a lot about where there are vaccine clinics and how to get a vaccine and who can get a vaccine at different times and when everything was rolling out. But most of my knowledge around that is because of my profession, and as a parent and as a community member and a parent of a child with special needs, I don't feel like I really received a lot of that direct messaging, even though as a healthcare provider, I felt like we were giving it. Um, and so I definitely think there was probably a little bit and probably remains a little bit of a gap in terms of that communication and also kind of who you tune into and what your sources are. Um, a few of the things that did I think work really well is I got a lot of direct communication from our regional center, where my daughter is a part of the regional center and she has a case manager there, and so I did get some emails and phone calls along the way. She is young enough that she's not yet eligible for a vaccine for COVID-19, but we got updates in terms of caregivers of individuals that are members of the regional center, and here's how you can get a vaccine. From our actual pediatrician clinics, I haven't gotten any direct communication. I reached out to my older daughter's pediatrician when I found out that 12-year-olds would be, it'd be available to 12-year-olds. And at that time they said, well, we don't actually have them yet. And I wound up getting her vaccinated through the school district's clinic. So I think there's a lot of modes for people to find out about it. Some of it requires being a little bit proactive on the part of people that are interested. And I think that there is a little bit of probably opportunity for improvement in terms of reaching the folks that may have some hesitancy and aren't super proactive about it themselves because they're already interested in receiving this vaccine or other vaccines. From a healthcare provider standpoint, I think one of the best things now that there is a lot more vaccine availability is as things have kind of trickled down to individual providers with their specific patients. I think that's probably one of the best modes, both of access and also of education, between individual physicians and their patients, as opposed to like major hospital networks or pharmacies that are just able to advertise that the vaccine is available, you should go get it. Is great for people that are already sort of doing their research and their homework and wanting that, but not necessarily for the rest.
And going off of that, would there be any kind of advice or kind of words of support that you could give to someone who is a caregiver of someone with a disability to kind of support their loved ones in helping to maybe reduce those barriers and kind of that gap that you were talking about earlier?
Yeah, I think I think everybody obviously makes decisions based on what a lot of it is out of fear, either fear of getting an illness that you can prevent with a vaccine, or fear of getting a vaccine that may have unknown side effects or consequences. And caregivers and parents of kids with special needs or individuals with additional special needs that they're supporting have those fears and concerns, but even amplified further because they've sort of adopted this role throughout life of having to be a really fierce advocate for somebody who sometimes can advocate for themselves but needs sort of an amplifier, and sometimes can't advocate for themselves. And so they've, I think, acquired this sort of tough exterior where they're like, you know what, you're not going to convince me of something that I'll be convinced when I'm convinced, type of thing, whether that's figuring out what are the best resources for your child in school, or figuring out what are the best job opportunities for an older adult, or figuring out what's the best home situation or the best therapies or interventions. And the same thing goes for medical care and medical providers, and vaccinations. So what I would tell and do tell other families and other parents and caregivers, if I'm asked the question, and in the other forums that I'm in, that I think is beneficial and really a lot of people didn't know, is there was a lot of effort spent in making sure that everybody knew how quickly this current vaccine was going to be developed, and how awesome it was that it came out so quickly. But there wasn't quite as much information disseminated about the fact that even though it came out very, very quickly, it was decades in the making, and that this technology has been worked on and developed and tested for many, many, many years. And it just so happened that they didn't really have the opportunity, or the driving force to finish those last few steps. So even though it seems like it came out extremely quickly and is untested, it's actually just those last final steps, which are always a lot of red tape getting through. That red tape was removed, but the science and development behind it was not skipped out on at all. And that one piece of information, I think, helps a lot of people to feel more comfortable about the potential and about the option. And then just continuing to emphasize, with every day that goes on and every month that goes on, how many more thousands and hundreds of thousands and millions of people have safely received something that is now preventing something that otherwise can be and has been very, very dangerous and serious. We always worry about, when I have 3 children and Avery's my middle child. So before we were all staying home and wearing masks all the time, we'd have like the standard viruses that go through the house every couple of weeks, and somebody brings something home from school or work and everybody gets sick. With the other kids, it's kind of a blip. With Avery, we were always paranoid, like, well, what's going to happen? Is she going to be able to handle this one? And is she going to get sicker than them? Is she going to miss more school than them? Is she going to have, secondary consequences? And so just the fear of illness is worse. And so to me, it was very reassuring that at some point, she will also be protected from something that could be significantly more dangerous for her than her siblings. So.
Yeah, thank you for sharing all of that. And I just kind of wanted to circle back to going for kind of the healthcare provider perspective. And I think you will have a very interesting perspective on this coming from both sides. So I was wondering, how would you recommend kind of a doctor or some sort of healthcare provider speak to patients and their families about COVID-19 in a way that is beneficial for them and gives them information and also gives them the tools they need to make decisions that will be best for their family. And we can also apply this to kind of any other conditions as well, and kind of other situations as well. So, but essentially the crux of this is, how do we get doctors and healthcare providers to effectively kind of share healthcare information with their patients and their families?
Yeah. I mean, I think sort of the standard rules of communication, even not in healthcare, kind of apply, especially when you're handling situations where there's a lot of different opinions and that there's a lot of different information that's available. If somebody approaches me and wants to talk about, some interesting fact that they heard on YouTube or from a friend or, from anything else, and I get the sense right off the bat that they're approaching it with I'm going to convince you of something because I already know this is right. My natural instinct is to sort of dig in and resist. And I think that the same thing is true of healthcare and healthcare providers. A lot of times physicians sort of because of the research that they've done, and because of the knowledge that they have and the education that they have, they're very confident in their in their understanding of something. But the approach to patients, or to families of patients, that that starts off the conversation with, this is why you need to do this, or have done this, or why haven't you, I think kind of puts people on their heels a bit. um, and so, just like any other form of communication, I think open-ended communication, trying to assess where somebody is when you start having that conversation, and then meet them where they are and figure out what pieces of information would be most beneficial, where they have questions, being able to be a non-threatening source of information, and reassure them about, concerns, or answer questions that they may have, and being honest. There are some things that we don't know the answer to, but based on the best information we have available, this is why, I recommend or don't recommend this in your particular situation. And the more transparency there is, the more people are able to sort of offer facts and also validate concerns. I understand that this is scary, because this is not something that we'd ever seen before, or there are a lot of scary stories out there about potential negative effects of vaccines, or it was really announced how quickly this came out, and I can understand how that would be, that would be somewhat concerning. However, I just want to reassure you that, what's not often advertised is that, this was the development process, and this is how many people they actually tested in large scale studies before it was ever even released. And these are the side effects that have come about, and that there are concerns about since rolling this out, and the ones that are continually being followed, and the ones that actually have been determined to not be any greater than the population at large, with or without a vaccine. So I think the more information that can be given in a non-threatening, non-confrontational, as some people see it, sort of condescending, like, well, I know better, so you should listen to me mentality, then the more success we have. Because when it's people feel like they're being lectured to, I think they're pretty apt to resist. But a lot of people genuinely are just concerned, and that concern is valid, and it's just out of a lack of understanding or knowledge of some of the details that can be clarified. Um, so yeah, I think, I try to ask people. I mostly am hospital based, and so I deal with patients that are coming in on an emergency basis, usually for reasons other than symptoms of COVID-19. But these days we see a lot of patients with it. Um, and I ask everybody the question, hey, so have you been able to get your COVID-19 vaccination yet? And to me, that does a few things. It sort of implies that, like, have you been able to, like, have there been any barriers that have prohibited you from getting it if you wanted it? And also sort of normalizing the fact that, subliminally, maybe the expectation is that everybody have it, and it would be great if everybody does. It's kind of one of those things like, hey, so have you been healthy recently? Have you had any problems recently? Have you gotten your COVID-19 vaccine yet? Not like, so are you going to get a vaccine? Like, I think a lot of it is sort of practicing that rolling out of, normalizing it. And then if patients, and then I just wait. And if patients say, like, oh yeah, I got this or got that, or, I had a patient the other day that said, no, I've been sick for the last 3 months and I haven't been able to drive and I don't have a ride, and, or other patients that are like, no, 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 I don't believe in that. And then that opens the door for a conversation. And then I can say, oh, well, tell me more about that. What are your concerns? Or are there any questions I can answer for you? Any resources I can give you? Just to help you, make an educated decision. The decision's always yours, but I want to make sure you have all the tools you need to make that decision.
That makes a lot of sense, and that's really good advice. Switching the gears a little bit. So you talked about your daughter a little bit. So you have a daughter with Rett syndrome, and I'm wondering, in your experience within the Rett's community, what are the thoughts or the feelings about the COVID-19 vaccine? Are there any hesitancies that you've kind of noticed being in that community?
Yeah, it's really interesting. I feel like, within the Rett community, it's really varied, and I tend to see people, and probably this is sort of a sampling bias of what you see that people are willing to speak out about, but I tend to see people in one extreme camp or the other. There are a few people that sort of come to most of the Rett community that I'm plugged in with. It's not a very common disease, so there's only a couple local families that I really know and am in person, direct contact with. Otherwise, it's a lot of online social media platforms where there's larger groups. But what I tend to see is people either basically saying like, I don't know how you would ever not get your kid vaccinated for this. Like, why would you take the chance? And then there's some people that are like, I don't know how you would ever, subject your kid to the risks of this vaccine. And so it's really, really, I see both extremes. Um, for me, the patterns I've noticed is it seems to fall more along the lines of how people globally feel about vaccines in general. Um, Again, at least in terms of what people are outspoken about, people that are big advocates for and proponents of and don't have major safety risk concerns about are also very um, not only supportive of the COVID vaccine, but in getting enough people vaccinated and particularly having access to get the vaccine for their child. um, and people that are skeptical of vaccines in general are much more hesitant to get it and are also much more concerned about the potential for being forced to get it. And again, I feel like a lot of that is just sort of misinformation and valid concerns, but not necessarily well-founded concerns. And so there is the opportunity to increase that education. So in those forums too, I sort of, I try to judge the tone. Sometimes I get the sense that my input is probably not going to be valuable, but if I do feel like there's the opportunity and somebody really is wondering genuinely about risks and benefits, that there's the opportunity to sort of weigh in with my other hat and be like, hey, I understand all those concerns. I have a daughter with Rett syndrome too. This is what I've seen on the medical side of things. This is why these are the choices that we're making for our family. And I hope sometimes that makes a difference. But yeah, I feel like probably just like society at large, it's extremely variable. Some people are very passionate about it on one side or another. And it's kind of that middle uncertainty area where there's the opportunity to make a difference.
Mhm. Yeah, and you talked about your daughter being a little too young to get the COVID vaccine for now, but can you just speak to maybe your overall experience with just vaccinations in general?
Yeah, I mean, it's been very positive. I do have sort of a funny story to share about my older daughter. So no kid likes shots, right? When my three kids all have had three very different responses to going to the doctor and getting their vaccines for different things along the way. None of them have ever been excited about it. Avery, that my daughter with Rett syndrome, is the one that's always been way tougher than the other ones and just takes it like a champ and just sort of watches them sticker. And then a couple times she tries to lean in and like, kiss or hug the person that just gave her the shot. She's just like, I don't, what's the big deal? But Kaylin, my oldest one, was very adverse to needles and hated, vaccines of any kind. And we're pretty rigorous even with the flu vaccine for the whole family. So I'd line them all up and we'd go to Safeway or go to the pediatrician. And Kaylin had these little cluster of a little outbreak on her elbow, which we think were just sort of benign little warts on her elbow that kids get. But it plagued her for years. She was so embarrassed by it. She was so annoyed by it. Nobody else could even tell that it was there. It was one of those tiny things that just she noticed. And then one day she noticed they were completely gone. And she's like, oh my gosh, they're not there anymore. I don't even know when they went away, but they're not there. And my husband, who incidentally is also a physician, was the one that pointed out, didn't you just like 6 months ago get your HPV vaccine? Like, because she had just turned 11 before, which is the same virus or in the same family. And we're like, oh my gosh, that's probably what did it. And she flipped into like a total, because now she had something concrete to associate it with, that she's like, oh, I can see that that vaccine made a difference to me in my life in terms of practical purposes. Obviously the main reason they get it is for much bigger consequences potentially, but now she doesn't complain. She was excited to get her COVID vaccine. She was excited for the potential of eventually going back to school without masks and seeing more of her friends, and also just not getting sick and not having to stress about it. And she doesn't complain about her flu shot anymore. And I've seen the same thing. And I think sometimes, sadly and unfortunately, that happens with the COVID vaccine too, is that, some people are pretty hesitant to get it. And then they maybe either have a really close call or a negative experience within their own family. And then that sways people, other people to go out and get it. And I really wish it didn't have to come to that. I have, another friend recently who went to dinner with 10 people. There were 2 people that were vaccinated and 8 of the 10 got COVID-19 with this new Delta variant, and the two that were vaccinated did not. And so we're still kind of waiting to see if anybody's going to get real sick from it. But I think that that was a very sort of real world, real time example of like, oh, I guess maybe it does make a difference. And the two that got vaccinated have had no problems with their vaccine, but they don't have COVID-19. And so I mean, our vaccine experience in general with the kids has been sort of typical for kids. They don't like needles, but we talk a lot about it. We have a lot of dialogue and conversation about the fact that, like, everything in life is about choices, and you got to choose sort of the least of the bad choices. So nobody wants to get a shot, nobody wants to get sick, but this shot is worse than this, or is better than this sickness. So that kind of helps the kids wrap their minds around it. And ultimately they know that because of what my husband and I do for a living, they don't have much choice. They're going to get all their vaccines. So they go with it.
Mhm. And do you have any like kind of helpful tips that may be helpful for families that don't have the expertise that you and your husband have?
Yeah, I would say, just like with almost anything in life, just get as much information as you can, but be careful about your sources. And we know that even within the medical community, even when we're reading medically published literature, there's some that's good and there's some that's not good. And you kind of have to be, you get better at sort of figuring out those sources and how reliable they are. But I would say find somebody that is trustworthy to you, but that also has the appropriate background to give you good advice. So, your family physician, your pediatrician, if you trust them, maybe a family member, but somebody who has, medical background. And if something doesn't sound right, ask other people, get other opinions. Um, it's fine to get a broad, a sort of a broad source of opinions. Just recognize that some of them should really kind of be taken with a grain of salt. Some of them may be very valid, but a very small sample size. So, for example, the one person who had an allergic reaction to, I mean, I'm allergic to tree nuts, but I recognize that for most people, they absolutely love nuts, and it probably improves their experience with their food. So, being careful not to generalize the wrong things, and basically just get all the information you can, but know your sources and make sure that you're going to trustworthy sources, because there's a lot of things you can find out there.
Mhm. And then on kind of on the flip side, what tips or recommendations would you have for the healthcare providers and the doctors to help facilitate that communication with parents or patients directly even?
Yeah. Um, so I mean, in addition to kind of what I touched on earlier about being open-ended, being non-confrontational, non-judgmental, I would also say don't make assumptions. Don't make assumptions that your patients have been vaccinated. Don't make assumptions that, that they have certain feelings about things already. I was speaking to one of our infectious disease critical care physicians at the hospital recently, who said he's just been intentionally setting aside like 5 minutes of every visit for patients that come in for any reason, even at just his standard daily office time, to have a vaccine conversation, and ask them if they've been vaccinated, if they have any concerns. If they have not, how about their family members? How about people they interact with? Are there any tools that I can give you as a patient who's already been vaccinated to help convince your brother or your son or whoever? So I think that making sure that the conversation comes up a lot, especially when you're one-on-one with patients who trust you, as opposed to just sort of being a voice that people may not trust or may not know who's behind it or who's funding it or where it's coming from. People are going to trust their own personal physician more than the picture of a physician on a billboard or a TV commercial or something like that. So the more that those more intimate conversations can happen with experiences that are occurring anyways, the better. I think that's more likely to make people feel comfortable and get results.
Yeah, thank you very much for sharing that. And I want to circle back to kind of your experience again. And I was just wondering, how has the pandemic changed, your lifestyle or the resources available for your daughter and also your family?
Yeah, that's a great question. So, when everything hit and everything sort of shut down very suddenly, Amir and I had to keep going to work because of what we do. So we couldn't stay home, but we lost our childcare. We cut off contact with the grandparents. We, all the extra sort of support that we had came to a screeching halt, but we were not able to work from home. So we really had to kind of scrounge and pull together the support that we needed. We were very fortunate at the time that my sister had just moved into town from across the country. And so rather than finding their own place, they just lived with us for a while and were sort of our live-in child care and adult support and extra family. Um, my oldest and my youngest, I say have responded pretty well to everything. They don't like distance learning. They are super excited to go back to school. I don't know that they'll ever again take school for granted. um, but I feel like they probably had setbacks, but were on par with all of their peers. The barriers to education were compounded, and therapies were compounded for Avery, because there's just no doubt we've always been pretty fierce advocates of her she's in full inclusion. She goes to a general education classroom. She's cognitively intact, but needs a lot of support and needs a lot of help to access the curriculum and she has really complex communication needs, and she needs highly specialized people to work with her who kind of understand the nuances and the complexities of Rett syndrome, and allow her the same opportunities as other people in terms of communication and education, and all of that shut down. So that was really a struggle. We did a lot of work through Zoom, but that's really hard because, for those that don't know, with Rett syndrome, they're nonverbal, but they communicate with their eyes. And so she has an eye gaze communication device where she controls it with her eye function. So it's really hard for her to be able to communicate if she needs to control a device with her eyes while also tuning into a Zoom through a screen in order to get any sort of education from a teacher. And then any therapy session she had to have another adult at home with her, because her physical therapist she had to do through Zoom, and her speech therapist she had to do through Zoom, and her occupational therapist. And so I felt like, if the other kids were getting maybe 85% of their typical experience because of what happened with the pandemic, she was getting, like, it was the opposite. She was maybe getting 15 and had an 85% hindrance. So I still feel like we're struggling with the sort of the setbacks of the results of all that, and who knows how long it'll kind of take to catch her up, with regard to even things being able to go back toward any sort of sense of normal. The other caveat is that she can't wear a face mask, and I'm a big proponent of face masks. But she just can't wear it because of her sensory issues and because of she had her oral needs, and so that is a further barrier to her access to things, because even when things started to open back up, it was with the caveat that kids needed to be masked and the therapist needed to be masked, and she can sort of tolerate a face shield but not a mask, so even that sort of shut her out from the resources and the intervention that she needed, on top of the concern that she doesn't have a vaccine yet. So, on the one hand, I really want to throw her back into all of her interventions. On the other hand, I'm concerned and I don't want her to get sick. And, with the surge and everything coming back and the numbers increasing, that's a little bit nerve-wracking, because I'm really like waiting every day to hear when she and her little brother can be vaccinated as well. But yeah, just general access to an equitable education was always a concern. I think that it was a huge hindrance to her, more so than my other children, when everything shut down. And so we're really hoping that we see sort of a turnaround and everything start to decrease again, so that she can safely and equitably go back to accessing education and literacy, and as typical of a childhood experience as she could get.
Mhm, mhm. And then just to follow up on that, are there any kind of current, I guess, like resources or programs that have kind of been helpful in getting these supports during kind of the pandemic times, or kind of what are things that you think should be developed or kind of should be there that you saw a gap of,
Yeah.
either in regards to getting the supports or towards maybe potentially, in the future when she's eligible to get the vaccine?
Right. So I think, and initially there was very much a like fend for yourself type of, everybody's kind of out on their own trying to figure out what to do. Um, and a lot of parents, I think, felt very sort of felt very abandoned by what am I supposed to do? And Avery, fortunately for Rett syndrome, is relatively high functioning, and even then she has significant limitations in what she can do, physically, and the supports that she needs. Some kids are far more limited than her in terms of their ability to do things independently. And then it was a very sad situation where kind of the individual families, depending on the access on the resources that they had, um, dictated what sort of services and access their children had to things. So I think, for us, I mean, one thing I consider ourselves very fortunate about is the fact that her dad and I are very medically literate and very, have access to knowing what she's entitled to and being able to fight for it. And it was still a huge struggle and continues to be. And so I just really feel for the families that don't have that background, don't have that access, and maybe don't have the ability or the energy to sort of fight for things, because they're so busy just trying to make sure that they can maintain the family and feed the family and keep their jobs and get through all this. So a concerted effort, on the part of places like the regional centers. I think the school districts, recognize that this has been obviously an unprecedented struggle in terms of the things that they have to deal with. But the special education departments within school districts, I think, and it's variable, but I think there needed to probably be a little bit more effort in terms of individually figuring out how to support these kids, even if schools weren't open for them. Things like figuring out therapists that would be comfortable, maybe meeting one on one with kids, masked or shielded or not, or going to experts in different fields and asking about opportunity, like how can a kid with Rett syndrome access education through a screen, because typically that's not really very well done. And there are those people that exist, but like anything else, it requires a little bit of extra effort and work, and most of that extra effort and work, at least for the first year or so, really kind of fell to individual parents and families. And I would say the vast majority just didn't really have the tools to address it. So it was very much survival mode. um, so I think it's probably a combination of a targeted approach and maybe increasing resources in some of those areas where the families just aren't really going to be able to access things or advocate for things on their own.
All right, thank you very much. That was my last kind of specific question for you. I just want to wrap this up by asking if there's anything that I haven't asked you that you think is important to share with the disability community, specifically in regards to vaccinations.
Yeah, I mean, I've probably sort of communicated most of that through my answers to the questions so far. I think, I make no attempt to hide kind of where I am on the spectrum of things. I'm very comfortable with the safety of this vaccine, especially in considering the risks and benefits of the vaccine versus what it's designed to prevent. I have become just more and more comfortable over the last many months of seeing, pretty much everybody around me, people that I work, since I work in the healthcare field, there's the vast majority of people that I work with and their families have also been vaccinated. I personally know of many people who have suffered consequences, including death from COVID-19, and I know of not a single one who have had major consequences or side effects from the vaccine. Um, all the sort of described side effects of your immune system working when you get the vaccine and can maybe feeling lousy for a few hours or a few days. I know a lot of people that have had those, but in comparison to what I've seen on the patient side of things, when people get COVID-19, it really just can be devastating and heartbreaking. And whatever can be done to prevent it, especially with this vaccine, which appears to be extremely safe and extremely effective. I was kind of joking with somebody at work the other day of like, my gosh, this thing is like 90% effective. We're never going to accept 65 as being good enough for the flu anymore. Like, where's my 95% effective vaccine for flu? So I think it really did surpass our greatest hopes of what a vaccine could do. my biggest reassurance for people is that it really was not, it was released in warp speed, but it wasn't actually developed in warp speed. It was targeted at the last minute specific to this virus, but the technology leading up to its development has been many, many years in the making. Many, many great minds and scientists, devoting their life to this. And unfortunately for us now. So I'm hopeful that the needle can continue to sort of slowly move to getting everybody covered and everybody protected, and COVID-19 becoming a very minor you know um, problem for society at large, and for the disability community, because Lord knows we have enough to worry about. We don't need another, pandemic concerns on top of everything else that people have to navigate for their kids and their family members.
Wonderful. Thank you very much for your time, Dr. Coates.
Yes, thank you. It was a pleasure.